Okay, so we are talking about vulva self-checks. I have here my pelvis model, and this one in particular is of the female anatomy. And so when you're doing your self-checks, grab a mirror. Maybe you need a magnifying glass too. And I suggest looking at yourself laying down, sitting up, standing. Your anatomy is, believe it or not, going to look different in different positions. So that is my biggest suggestion. And when you go take a look to orient yourself a little bit, this bony structure you'll be able to palpate and feel. It is typically where your hairline starts, okay? You'll feel the bony structure, you'll come down, and you'll be heading towards your vulva. So again, your vulva is your external anatomy. And so what you'll see is what's called a clitoral hood. And this may be bigger, this may be smaller for you. Your clitoral hood protects an internal organ called your clitoris. When you come down, clitoral hood may or may not see your clitoris. When you come down, this is your inner labia. These are your inner lips. On the outside is your external labia, okay? Your internal lips, your internal labia, you may have to open a little bit to try and look for these other features. This small hole right here is called your urethral opening, and this is where urine comes out. You may or may not be able to see your introitus, which is the opening to your vaginal canal. This right here is your vagina. The rest of this is called your vulva. When you're looking at your anatomy, the most important thing to note is that no two vulvas are alike. So do not compare yours to anybody else's or anyone that you may have seen before, okay? You are unique, which is wonderful. While we're looking at ourselves, we want to look for any redness, irritation, swelling, change in coloring, maybe some dark spots, maybe some white spots, possibly some lesions or bumps. And you're just gonna make a mental note of what you see down there. If any part of your body is causing pain or sensitivity, go a step further and remember where you were feeling those sensations, okay? This is gonna help you be a better advocate for your own health. And if you notice anything down there to you that does not look normal, is not what you were expecting to see, doesn't hurt to reach out to your gynecologist. If you have a pelvic floor therapist, check in with them. There are dermatologists as well who look at vulvas. So don't panic, but if anything, it's a really good baseline so that next time you do your vulva check, you can see if anything has changed, okay? So after you've given your vulva a good look over, you can come down here and look at your perineum, the space in between your anus and your vulva, between your anus and your vaginal canal. This is typically if you've had a baby, maybe you had some tearing or you had an episiotomy with stitches. This area would likely have some scar tissue if that's the case. If you feel comfortable, do some self-massage up and down, side to side. Feel if you feel any adhesions or any stickiness, if it's difficult to move or not, if you have any sensitivity or pain. That's important to note, okay? You can go ahead and also look at your anus. See if you notice anything different down there than you were expecting to see, or if anything's bothering you, take note at what it looks like, okay? And along with self-massage down here, if you feel comfortable, your clitoral hood is something that we like to see slide and glide, okay? So take your finger and go ahead and see if it has mobility, if it's free to move. That is something also that's important to note. And I think that is it for our vulva self-check. If you have any questions, please let me know. And I hope I motivated you to take a look. And every time you check your boobs, check your vulva, okay? This is an important part of our body that we don't look at enough. All right, thank you, bye.